Good evening. My name is Janine Salente, and I'm the Executive Director at the Diabetes Foundation. Welcome to Diabetes Care Month. Today, we'll be discussing key steps to diabetes success. Our Diabetes Care Month is a 4-part series dedicated to providing you with information to support your health. By bringing together healthcare partners, government, and community leaders, we hope that these sessions will help you break down the barriers to self-care that you're experiencing. Whether you're at risk of developing diabetes or managing type 1, type 2, prediabetes, gestational diabetes, controlling blood sugar can help you prevent or delay complications. At the Diabetes Foundation, we know that the most manageable diabetes is yours. If you know what to do, where to find support, and are encouraged to follow through with your diabetes care. Our programs, we offer the education, the guidance, and the support that you need to achieve your goals. Today's session was organized with great purpose to help explain the standards of diabetes care, provide you with new technologies and community programs that can support your long-term health and wellness. My hope and that of our trustees is that our session today will inspire you to come to us for help, to refer a friend or a family member, or of course, a patient. Before I turn the session over to our moderator, Michelle Lourenco, I want to encourage you to utilize the Q&A function at the bottom of your screen to ask any questions you may have. If we don't get to answer them today, we will email you the answer after the session is concluded. I want to thank all of our Diabetes Care Month sponsors for their generosity. With their help, we're able to provide our services entirely for free. Thank you to BD, Essentia, M&T Bank, the Russell Berry Foundation, Healthcare Foundation of New Jersey, Horizon Foundation for New Jersey, Sanofi, BioReference, the George Link Charitable Trust, the Association of Diabetes Care and Education Specialists, Bergen Newbridge Medical Center, Wegmans, Nanette Empney Bryan Foundation, and the S. Rubenstein Family Foundation. As I mentioned, Michelle Lourenco is our moderator for today's session. She is a great friend to the Diabetes Foundation, providing virtual support in the form of webinars to our participants and always providing guidance to myself and to our staff. Michelle is a registered nurse and a certified diabetes care and education specialist. She works at Cooper University Healthcare and is a member of the Diabetes Wellness Center. Michelle works with children and adults living with diabetes, and she, in addition to her role at Cooper, she is also a nurse at Camp Najeda, a summer camp for children living with diabetes. Thank you, Michelle, so much for leading us through today's event, and I am officially handing the session over to you.
Thank you, Janine. It's my absolute pleasure to be here today, and thank you for the invitation to host today's event. Diabetes is definitely an epidemic, and it's one that's going to live long after the COVID-19 pandemic is in our rear view. For many of us in New Jersey and the nation living with diabetes, the condition affects life each and every day. The COVID-19 pandemic laid bare the ease at which the virus can make significant, if not life-threatening impact on the lives of those living with diabetes. This has made diabetes self-care even more important as we look towards the end of the pandemic. Whether you or a loved one live with diabetes, this session will address the questions: what is diabetes? How do I live with my life with diabetes? And what steps do I need to take to live my best life with diabetes? Bringing together some of the Diabetes Foundation's top healthcare partners, as well as certified diabetes educators, this session will help to provide a sense of comfort in knowing how you should assemble the best healthcare team to keep in top shape, and we will answer the burning questions you may have. Before we get our first speaker, we're going to launch a poll. The first poll of the day asks, do you feel like you have enough support to manage your diabetes? We ask the audience to answer the poll when it pops up on the screen. We're going to leave the poll open for a few minutes. And we'll share the results at the end of today's program. Our first speaker today is Dr. Colette Knight. Dr. Colette Knight is the chair of Insera Family Diabetes Institute. Division Director of the Endocrinology and Metabolism, and an Associate Professor of Medicine at Hackensack University Medical Center. Dr. Knight is a graduate of Harvard Medical School and completed her internal medicine residency training at New York Presbyterian, Columbia University Medical Center in New York, followed by a clinical and research fellowship in endocrinology at Albert Einstein College of Medicine and Montefiore Medical Center in the Bronx. She has extensive experience as a clinician, an educator, and an investigator. Dr. Knight is invested in building top-notch diabetes programs to provide the best care for persons with diabetes. Without further delay, Dr. Colette Knight.
Thank you so much, Michelle. It's really an honor to be able to participate in this Diabetes Care Month. And I'm certainly grateful for the Diabetes Foundation for this invitation. So for this talk, we will be focusing on the things that you can do to position yourself for success in managing diabetes. We know that this can be a very challenging disease, and as much support as possible is needed. So one of the first things that you need to do is to surround yourself with a supportive team of experts who can help you. For many patients, the first provider that you meet is your primary care physician. Perhaps that's the person that actually made the diagnosis of diabetes. That is likely to be the person who will be the main coordinator of your care and will refer you to other specialists. But most importantly, this is the person that will be following you long-term, will be ensuring that you have your medications, you have your supplies, that you continue to be educated throughout the process, and that you're supported. Another expert that you might meet is an endocrinologist like myself. So we are physicians who specialize in treating diabetes and other hormone conditions. Endocrinologists can help you in identifying what your diabetes is, setting goals, determining the best treatment plan that works for you, but certainly giving you pointers, tips, and support along this journey. They're the ones who are always going to be there. Diabetes does not always stay the same. It's a disease that can change as you go through life changes as well. Another partner in this journey are certified diabetes care and education specialists. They can be some of the most important persons that you will meet. They counsel, they educate on diabetes, they sort of teach you the nuts and bolts, how to monitor your glucose, what you should use to monitor, what are the targets that you need to meet, what is it that you need to do for yourself in terms of diabetes self-care. Often they're the persons that you reach out to when you have the questions to ask about what it is that you need to do. A nutritionist or registered dietitian sometimes work hand in hand with the CDC to manage your diabetes. They help with meal plans, developing healthy eating patterns, and certainly goal setting. Foot care is extremely important in diabetes, and podiatrists are the providers who specialize in that. So they may help to check the health of your feet. They assist in nail clipping, checking circulation, checking the integrity of the nerves, whether you have nerve pain or not. They also educate you on the daily steps that you need to do to make sure that your feet are healthy. Eye care is also important. And ophthalmologists are physicians who monitor the eyes and make sure that they are healthy. And if they determine a problem, for example, maybe a developing cataract, that's where the lens become cloudy, or there might be bleeding in the eye, that's called retinopathy, they will be able to devise a treatment that you need. And then we have other specialists that might be important depending on what other conditions you may have. So a nephrologist who specialize in kidney disease, or a cardiologist might be important if you have had a myocardial infarction, if you have known coronary artery disease, that's where there's a blockage in the heart vessel, or an abnormal heart rhythm, or valvular disease. Diabetes can be quite stressful, so it's really important to have a mental health professional. This could be a psychiatrist, a psychologist, or a social worker. Generally, your primary care physician or endocrinologist may have personnel who they work with and who can support you and provide you with the tools and equipment that you need to continue to stay healthy and whole as you work through the process of taking care of diabetes. Next slide. So, in terms of determining what it is that you need to do, you have to think about goal settings. Goals should be SMART, specific, measurable, attainable, realistic, and time sensitive. So, in terms of thinking about diabetes and being specific, you have to think of a goal, something very practical that you can actually do. So, it could be as simple as I will check my glucose every day, or I will work to lower my A1C by 1 percentage point, maybe in 3 months. So, setting very specific goals in terms of what it is you want to achieve is important. It's also good to talk over these goals with your doctor or your provider to make sure that they actually can be done. It is good to have goals that are measurable, something that you can see and do. Measuring glucose is a very measurable goal. Thinking about how to eat more healthy is something that you can do. You can measure what you're eating, you can assess portion size. It has to be something that's attainable, that you know that you are going to be able to do this in the time that you have designated to get it done. It also has to be realistic. So if you think about some of the challenges that one might face in diabetes, you may have to ask yourself, is it really realistic that you will be checking your finger stick before every meal? Or is it more realistic that you will check every morning? Well, maybe every morning might be easier. And so that's a realistic goal. Or maybe you may want to cut back on eating sugary sweets or dessert. So would you cut back and say, well, I'm not going to have cake at all? Or is it more realistic to say, I can reduce the amount of sugary foods by about 50%. And so you really have to know yourself in terms of determining what goals you can actually meet. And then there should be some time that's assigned to that goal. For example, if it's weight loss, well, maybe it could be that you want to lose 10 pounds in 3 months. So once you have that time, then you can work in a more actionable way towards achieving that goal. Or maybe it's lowering your A1C or something else, or maybe getting all of your necessary appointments to see the eye doctor, the foot doctor, or so on within a 3-month period. And so it's important that as you think about diabetes, that you constantly think about this acronym. Am I being smart about my diabetes? Am I being smart about setting the goals that I need to have in order to get this right? Next slide. So there are a number of things that you will need to do to reduce your risk for diabetes and achieve better health. This includes healthy eating, being active, medication management, monitoring, reducing risk, problem solving, and healthy coping. I will go through each one of them with you. Healthy eating, you just sort of think about this very simply. Your diabetes is what you eat. What does it mean then? Eating whole foods, fresh fruits, vegetables, multigrain, whole wheat, being very purposeful about avoiding any unnecessary sugar, whether it's in juices or marinades, you know, items used in food preps. That is really important. We have this idea of the healthy plate. So a typical 8 to 9 inch plate, and half of that plate should be vegetable or salad. A quarter will be protein, and another quarter will be the starch, which could be the rice, pasta, potato, or something like that. Beverage could be water or something equivalent. But your goal is to have a very balanced eating habit every time. And then thinking about how you prepare your meals is also important. Avoid frying as much as possible. You can grill, boil, bake, steam. Those are healthy ways to prepare. But it's really important that as you think about what you want to eat, that you actually choose things that you like and that you are likely to eat and eat in abundance. It's good to try new recipes. Make a list before you go shopping so that as you pack that cart, it's full of healthy items that can nourish you and make you better, but also stabilize your diabetes. Let's talk about being active. In terms of managing diabetes, exercise is simply a way of life. It makes you feel better. It's a great stabilizer for glucose. Simply taking a walk after dinner will help to lower your glucose and give you a much better glucose overnight than you would have had if you did not. The recommendations are that you should exercise for 30 minutes, 5 days a week. Again, choose an activity that is enjoyable to you. Walking, ice skating. Maybe you may want to go to a gym. The decision to have a personal trainer can be very helpful because it's good sometimes to have a little bit more structure or someone who can sort of help you to have a plan that you can work with. Finding an exercise partner is also very helpful too, because that person can certainly support you and motivate you during the process. So, those are certainly things that you might want to think about. But just in your everyday activity, there are many opportunities to exercise. The weather is warm now, so you can go out, you can do some gardening, you do housework, you can walk around the neighborhood, you can go to the local park. Um, if you are able to walk to or from work, that's actually a good thing. You may want to think about climbing stairs instead of taking the escalator or elevator. So just think about ways in which you can put activity into your day. And that is going to be a great plus in terms of managing your diabetes. In terms of medication, there are many factors that you have to think about. It's really important that you have a detailed discussion with your doctor about what that medication plan will look like. The choice in medication for diabetes will depend in part on your glucose. What is your A1C at diagnosis? What type of diabetes do you have? If you have type 1 diabetes where there's insulin deficiency, then the treatment will be insulin. If you have type 2 diabetes where you have some insulin, but you might be resistant to it, then you have potentially other choices. Tablets that some might be more familiar with, for example, metformin and others, but you may also need insulin as well, and your doctor will help you with that. We also have non-insulin injections that can be given daily or once a week, and those have been proven to be quite effective. It's important to discuss with your doctor your concerns about these medications, side effects, length of time that you may have to take them, how you may have to take them. It is not unusual that most people are concerned about injectables. It's good to talk through that with your provider. And then you need to discuss the other conditions that you may have. If you would like to lose weight, then there are some medications that work better than others for that purpose. If you have heart disease, we now have a new class of medication, the SGLT2 medications that have been proven to have benefits for heart failure or even and others as well. So those are some of the things that you need to think about. If you have kidney disease, for example, there may be some medications that you may want to avoid. So the choice is important. It's always good to know that the way we think about managing diabetes is that it's much broader than just lowering glucose. We want to make sure that we lower glucose, we improve heart health, we prevent weight gain, and we basically give the patient a general sense of satisfaction with what they are taking. Diabetes management also includes managing your blood pressure. So it's important to choose the right medication for that. We also need to think about how we protect the kidneys, especially if we see evidence of protein in the urine. And so that's another area that one might need to discuss. Cholesterol management is extremely important as part of the treatment regimen for managing diabetes. And so these are all the areas that you need to discuss with your physician. Another thing you may want to think about is how to sort of structure the way you get your medications. It's actually good to talk to your pharmacy to see if you can get all of your medications on schedule so that you can pick them up at the same time, and then you have a way of organizing them so that you can remember when to take them. It may be helpful to have a timer, especially if you have medications throughout the day that you need to follow up on. Be mindful of side effects that might be associated with the medications that you take. And if you develop them, be sure to contact your doctor or your provider so that they can guide you on what is best. Most importantly, do not stop medications without consulting with your providers because that may lead to worsening glucose control. In terms of managing diabetes, you need to know your numbers because that's how you know if the medication is working or if you are on track. There are several ways that we monitor. We can use a traditional glucose meter that I think many people are familiar with. That's where you take a lancet, you poke the finger, and you draw some blood into a test strip and you put it into a machine. But as you know, we now have other monitors that are called sensors that are able to detect glucose and are very portable. You get the reading in real time, and many people have found them easy to read. If you would like to know if you would be eligible for such a device, please talk to your provider about that. But you also need to know when you are monitoring, what targets do you want to achieve? For most people, the fasting glucose should be between 80 to 130. Fasting is the glucose that you take in the morning. And then before each meal, it should be about 80 to 130, and 2 hours after eating, less than 180. But your doctor may have another individualized plan for you. And so you may need to determine that. How often should you check? If you are on insulin, especially if you are injecting multiple times a day, then you would want to check before each meal and at bedtime. That's usually the standard testing. If you are only on tablets, you could test once a day or twice a day. But these are pointers again that you would want to discuss with your provider. The glucose really helps you to know if the medication is working to keep your glucose normal. Perhaps your glucose is too low, a low glucose is less than 70, or maybe the glucose is very high, more than 200 or higher. And so by monitoring, it allows you to see exactly what is happening, and you can intervene and you can make corrections very quickly. The glucose also helps us to figure out another test, which is the A1C. That's the amount of sugar on your red blood cells. And so there is actually a correlation between the two. And by looking at your glucose, you could have a sense of where the A1C is going. And that could be important. Many people are sometimes afraid to monitor their glucose because they're afraid to see what the numbers are. Don't be afraid of the numbers. Just remember that they are always there to inform you about the management that is happening. And by knowing the numbers, you can actually have a direct impact on how your diabetes is managed. Let's talk about reducing risks. Diabetes is a systemic disease, meaning it affects many different organs throughout the body. It can affect the brain, leading to a stroke. It can affect the heart, leading to heart disease. It can affect the kidneys, leading to kidney failure. Also affects circulation, can affect the eyes. It's one of the number one cause of blindness. But there are things that you can do to assess your risks for any of these conditions. So usually when you visit your doctor, there are several tests that you will be asked to do. Generally, an A1C is checked, usually every 3 months. But if someone is very well controlled, it could be every 6 months. We also checked a fasting cholesterol profile. What do we hope to see there? That the total cholesterol is less than 200, the LDL is less than 100, triglycerides less than 150, HDL more than 50 for women, and more than 40 for men. Based on those values, your doctor will make recommendations about the best treatment for you. Every person with diabetes, especially if you have type 2 diabetes, should be seen by an eye doctor at least once a year. If they determine that there's a problem, then they could advise you to be seen more frequently. You should have routine foot exams in your doctor's office. If you've had any amputation, a non-healing ulcer, or any foot issues in the past, then you should have an exam every time you go to the doctor's office. Those are really important things that you need to do. If you have symptoms, chest pain, shortness of breath, you want to inform your doctor. They will consider doing a heart evaluation. And so a significant part of why we want to improve diabetes management and stabilize it is to prevent the development of any of these adverse outcomes. In terms of problem solving, there will always be issues to solve in diabetes. It could be an issue with medication, an issue with glucose, other end organ problems. The main goal is to identify what this problem is and to work with your provider to determine how it can be treated. So you should always sort of be in that active state of mind to plan and act on what you see. And finally, healthy coping. Diabetes can be a very stressful condition, and it is important to take care of sort of the mental aspects of this as well. Many times we don't talk about this enough, about the fear, the uncertainty, the self-doubt, the guilt, and the distress that comes with managing diabetes. But all of these are emotions that you can have at any time. And so it's important to be open and honest with your providers if you are feeling any of these emotions, but also to be proactive about getting help. But there are some simple things that you can also do for yourself. One, make time for yourself and enjoy things that are healthy to you. It could be reading, listening to music, you know, catching up with friends. Just always carve out that time for yourself. It's really important that you may want to consider joining a support group. In New Jersey, we certainly have multiple support groups for diabetes. In general, there's support groups for those on insulin pumps and so on. And so it may just take a little bit of work, but your certified diabetes educator, your providers may all have good resources that you can actually tap into. We know that peer-to-peer support is an important part of diabetes management, and it's really important for you to get that type of support and that connection as you work through this process of managing your diabetes. So I just want to encourage you to be very proactive about managing diabetes. This is a disease, though it has its challenges, you can do very well if you have the right team, if you are smart about defining your goals, and if you follow through in terms of just eating healthy, being very active, working very closely with your providers in terms of determining the best treatment plan that works for you. And finally, really being in tune to how you're coping with this disease and find ways to do that in a healthy way. Thank you so much.
Thank you, Dr. Knight, for that informative presentation. Our next speaker is Dr. Brian Flug. Dr. Flug is the Medical Director for US Canada regions for BD Diabetes Care. BD is a generous supporter of the Diabetes Foundation and our programs, services, and public events. Dr. Flug received his Doctor of Pharmacy from Xavier University of Louisiana in 1997. For the past 22 years, he's worked at multiple pharmaceutical and medical device companies, including Santa Fe and Bayer. At BD Diabetes Care, he specializes in diabetes research and education. Dr. Flug?
Thank you, everyone, and welcome to this presentation. I'm really excited to be here. And wow, 22 years have been a long time. Things have really changed when I first came into the industries. Pharmaceuticals have really increased with GLP-1s and SGLT2s, DPP-4s, as well as a lot of new technology as well is really helping patients with diabetes get through lives easier and better managed. So I'm going to go over some of the more pertinent developments in technology, and it will not be an exhaustive review of all technology. As you know, it is always in the news, always things are coming, and not everything comes to the market. But these are the main things that are really, I think, are relevant to you. And if you have any more questions or you need any more information with regards to any of these technologies, please contact your healthcare provider, or maybe just go online and Google these different technologies. There's a lot of information out there, but don't get overwhelmed. I'm going to just try to show a couple of pictures of some of the different technologies, and really just more going to have a conversation about some of the benefits of these technologies in helping you with diabetes. So I just want to start off by, it's always rumors with what Apple is doing out in the field. But both Samsung and Apple are rumored to be working on really non-invasive glucose sensings for their respective watches. I also heard that Samsung might even be coming out with their watch in this first half of this year. But again, only rumors. But Apple especially is putting a lot of money into trying to make it easier for patients with diabetes to monitor their glucose, which is so important in getting healthy. Also, CGM has really, or continuous glucose monitoring, has really taken off in these past couple of years. Really, one with the Freestyle Libre systems, where they're actually, it's called a flash glucose monitoring, where you actually put a sensor on your arm, and whenever you want your glucose, you can actually just wave this reader or the phone even, and it gives you your glucose reading, whether or not it's going up or down, which is very important, because if you use just a regular glucose monitor, it tells you where your glucose is at that point. But you don't know whether or not it's going up, which would be great if you're about ready to exercise. But if it's going down, that same number might be bad, because as you know, exercising will actually further decrease that glucose level. So it's really important to know where your glucose is going, not only what it is at that specific time. And also the reader will show that you have like 8 hours of information previous. So it can really tell you if you've been in goal or not at goal, and may give you actually pattern recognition on if you maybe take your reading before you have dinner, and then you can take it afterwards, and then you can see how much did this dinner really affect your glucose. And if it affected it a whole lot, then maybe you can either decrease portions, or maybe change some of the things that you're eating. And it's an easy way to really start taking control of your diabetes right then and there. Some of the other continuous glucose monitors is by Dexcom, the G6, and also Medtronic, the Guardian systems. These are some more of the older type of CGMs, but they're not old in technology, but they're more utilized by those with type 1 diabetes. And it continuously, on your reader, after you put your sensor on, the reader continuously reads your glucose levels. And you don't have to actually put it close to the arm like the Freestyle Libre to get your number. It will continuously be apparent on your reader or on your phone or on your watch, and that will have alarms so that if you're going low or going high, it would actually alarm you to then take an action. And then you can actually dose your insulin off of it. So a lot of it makes it easier, so you're not always sticking yourself to do blood glucose readings with your glucose meter, but these continuous glucose monitors actually make it easier for you to continually look at how you're doing, and what you're doing is affecting what your glucose is. So I think it's the technology here is ever improving. They're very accurate. And I think we can only expect more from these different types of technologies, especially when you combine them with insulin pumps. Wow, you can really get some really good technology like that. Next slide. And so combining those CGMs or those continuous glucose monitors with your insulin pens now. So now they're actually called smart insulin pens. Medtronic has the InPen, and Bigfoot actually just got FDA approved for their pen system. So you would actually, these pens will actually put into your phone, or a reader will actually automatically note what insulin dose you're giving, and it actually will what glucose reading you were. It actually may help you decide how much insulin you're using, so you never have to use a logbook. It automatically would download from your smart insulin pen to the reader or to your smartphone. So again, it just makes it easier for you to then talk with your healthcare provider on what doses you were giving per glucose's readings, and it just makes it easier to have that conversation. Again, we want to make things as easy as possible, because if it makes it easier, people tend to use them more. And I think that's such a great way to have these insulin pens with these smart insulin pens. Now, the insulin pump systems are actually combining the insulin pumps with the CGMs, and they're actually called hybrid closed loop technology, where the CGM is read by this algorithm, and the algorithm actually tells the insulin pump how much of a basal insulin it should be giving. Because an insulin pump always utilizes rapid acting insulin, but for that background insulin, it gives out a little bit every 5 minutes or so. So that's considered your background insulin. And then you have to program the pump to give you a bolus dose when you say you're going to eat something. So now this hybrid closed loop technology will automatically adjust your basal insulin, so that when you're sleeping at night, it won't allow you to go too low or too high. It will adjust it. Now, there are a lot of clinical trials that are actually taking place that will have closed loop technology, where the pump will automatically not only dose that basal insulin, but will automatically dose your bolus doses as well, so that really the person using the device doesn't really have to do a lot to control their diabetes, because the pump is actually pumping all the insulin when it's needed. Now, MiniMed as well as the T-Slim actually have this technology. And there's a lot of other groups that are actually working on this closed loop system. So hopefully in the very near future, that will be a possibility for those, especially with type 1 diabetes. Now, insulin pods are actually gaining a lot of momentum in use, mainly for type 2 diabetes, but also for type 1 as well. And actually, the pod actually sits on your skin, where you don't need a tube to go to the insulin pump. All the insulin sits on the pod itself, and then the pod automatically injects the insulin into your under your skin. So you don't even have any tubes. It's just kind of wearing like a white device on your body. It's not as noticeable per se as maybe a tube that goes into your body from this insulin delivery system. So again, a lot of new information that's coming out on these different types of insulin delivery systems. The smart pens are really something there, as well as these closed loop or hybrid loop systems. So more information to follow, hopefully soon. Next slide. Also, there's been a lot of development in insulin pen needles. Insulin pen needles are still patients who need insulin to treat their diabetes, either type 1 or type 2, use a lot of insulin pen needles for their pens. And the technology has really increased in the last 10 years or so. And now pen needles actually are as low as 3.5 millimeters. Now, if you look at the graph to the right, that's a 12.7 millimeter pen needle. Those are pretty long, and they go all the way down to this graph shows a 4 millimeter pen needle. Now, why would somebody use a 12.7 millimeter pen needle compared to a 4 millimeter pen needle? Is there any specific patient that a person needs one needle besides the other? And actually, it's no. You only need, say, a 4 millimeter pen needle to actually go through the skin, because the skin on everybody, no matter race, ethnicity, gender, it's only about 2.5 millimeters. So all you need is a needle to actually go through the skin to go into the fat tissue. And all you need to have is more than 2.5 or to 3 millimeters. And so 4 millimeters or 5 millimeters that the ADA recommends, it's great to actually use those lower insulin pen needles. You don't have to pinch up. You go straight into the skin, deliver your dose, less pain. And so most patients who are on larger needles, they would just utilize that when they were first diagnosed or first utilizing insulin, and they've been using the same pen needle the whole time. Well, technology and science has really caught up. And again, you only need a 4 millimeter or 5 millimeter pen needle. And that's what the ADA recommends as well. Also, a lot of information now is on not only a pen needle, but actually what does the pen needle sit on? And that's called the hub. Now, to the left is a posted hub, and on to the right, it's called a contoured hub. Now, what's the difference with that? Well, people utilize a lot of different forces when they inject. And if they use a posted hub, you can actually push the needle into the skin further than 4 millimeters. And that may be bad because you don't want to go into the muscle, because then you don't get your right insulin to work the best. So you really want to make sure it's in the subcutaneous tissue or in that fat layer. And as you can see on the bottom graph with the contoured pen needle hub, it doesn't go as deep with the needle. It passes the skin, but you have a less chance of actually getting an intramuscular or a shot into the muscle, which is you don't want. So again, a lot of new information out there on pen needles, on insulin pens, CGMs, and soon to be, hopefully, new watches who could actually work as a BGM. So I want to thank everybody for listening. And if you have any questions, I think we have some time afterwards. We can talk about it. And again, if you need information, you can always contact your healthcare provider. So thank you very much.
Thank you, Dr. Flug, for that exciting look at technology and the look into the future. Our next speaker is Dr. Steven Peskin. Dr. Peskin is the Senior Medical Director, Clinical Innovations, Horizon Healthcare Innovations, part of the Horizon Blue Cross and Blue Shield of New Jersey. Dr. Peskin's expertise encompasses physician leadership, medical delivery management, performance improvement in healthcare, contracting, as well as application and technology that includes mobile, social media, and clinical scientific communications for the healthcare professional and consumer audiences. Dr. Peskin has authored several industry articles, book chapters, and has spoken at various conferences and events about physician leadership, the medical home, mobile health, and social media. Dr. Peskin received a bachelor's degree from the University of North Carolina, Chapel Hill, and a medical degree from Emory University School of Medicine. He completed residency at St. Elizabeth's Medical Center in Boston and holds an MBA from Sloan School of Management at Massachusetts Institute of Technology. Welcome, Dr. Peskin.
Thank you so much, Michelle. I'm a general internist, and I'm still a real doctor one afternoon a week in what's called a federally qualified health center in New Brunswick, New Jersey, where I have the privilege to teach internal medicine residents. And diabetes is very much front and center, ever present every time I'm in clinic. So don't do nearly as much as Dr. Knight and Dr. Flug. That was a great presentation on technology. Horizon, we cover about 3.5 million persons, almost 1 million in Medicaid, about 2.5 million in commercial insurance, and a number of persons in Medicare Advantage, including our recent program with Hackensack Meridian Rivalwood called Braven Health. So diabetes is vitally important in terms of our work with our clinical partners, folks like Dr. Knight and other great physicians at Hackensack Meridian and other places. We have some efforts that we as an insurance company harmonize with our clinical partners with care management or case management with nurses, social workers. We have a Neighbors in Health program. I'm sure many of the folks on this call have heard about the increased focus and emphasis on social determinants of health, vulnerabilities related to the living situation, lack of transportation or the lack thereof, food insecurity, housing insecurity. So that's something that we've been working with Robert Wood and Hackensack and Cooper and St. Joe's and many others on. Again, we collaborate with physicians and health educators. It's definitely in my work at Chandler, it's definitely a team activity. Evelyn Garcia, phenomenal diabetes educator, bilingual. We have community health workers and social workers that get involved with other aspects. We have a nutritionist. We also have a podiatrist at our clinic. So, and then within the Horizon construct, there was a question in the chat about continuous glucose monitoring. We do pay for that. For anyone who's interested, our medical policy, both for Medicaid and for commercial insurance, is publicly available. There's no secret code that you need or passwords or anything like that. I just made sure I looked it up before I spoke today just to make sure, because there was a question in the chat. There's also a question in the chat about diabetes reversal. I wish it were more common. It's not that common. On the other hand, there are people who are able to actually go off of insulin and go largely off of oral medications. Again, I'm not going to preach about plant-based diet or anything like that. I'll let Dr. Neil Barnard and others do that so eloquently. But there is the opportunity for persons with type 2 diabetes. My nephew's a type 1, so that's not going to work for him. But thank God he's doing well and developed diabetes at 14, and now he's a healthy 30-year-old. Next slide. So we focus what we call our value-based programs. These are ways that we work with clinicians, whether she be a solo family physician or she be an endocrinologist or a large medical group like Summit or Hackensack. And we really focus on what we call the quadruple aim, fancy schmancy term. So it's a big focus on quality. Diabetes, as you can see, accounts for 50% of the quality measures. So certainly diabetes is very front and center. We look at what's called patient experience. You may know it also as satisfaction surveys, how people respond to their healthcare professionals, physicians, educators, social workers, medical assistants. And we also look at cost, and it's not just about pitching pennies or reducing costs, but looking at what we call delivering high value care. So we know that there's some care that's unnecessary. Dr. Atul Gawande, more eloquent than me, and his great article called Overkill, where doing more can be worse for people, not better. Certainly, again, things like continuous blood glucose monitoring and some of the great new technologies that were described are vitally important. And the fourth part of what we do is looking at healthcare professional sustainability. What Dr. Christine Sinsky talks about is bringing back joy into the practice of medicine or nursing. And trying to reduce administrative burden, reducing some of what my physician colleagues call the hassle factor that is foisted upon them by Medicare and insurance companies and that sort of thing. So trying to expunge some of that and also do a better job with sharing information across healthcare professionals. Next slide. So we have a lot of initiatives in pharmacy, and shout out to my colleague, Dr. Syra John, our chief pharmacy officer, and a couple of her colleagues to help me put this together. So with diabetes, we did again, a fancy term, rapid cycle analytics. Apologize for the jargon. Dr. Knight mentioned the SGLT2 inhibitors. So we found that, in fact, yes, these drugs are beneficial, and they are not generic. They are brand name, and we're actually, lo and behold, an insurance company is actually promoting branded products because we see it as better care and appropriate care and improving the care of certain persons with diabetes, especially those with any level of heart failure. We do a lot of things around making sure people get their medication, what's called persistency and endurance. Probably should expunge non-adherence. So, because that sounds like we're saying you need to adhere, and it's really more about persistency and endurance, and people understanding why they're taking the medicines, the reason they're taking their medicines, and that it's actually helping them to improve their health. We're also working, many of you on the phone will be familiar with the term statin. That's the primary drug that's used to reduce cholesterol. Many hundreds, tens of millions of people are on statins. Persons with diabetes, most need to be on statins to address cardiovascular risk. Next slide. And I think this is my last one. So more on pharmacy. We provide overview and reports, again, there's that word persistency, looking at geographic and national benchmarks, motivating change as a health ambassador for diabetes. We work with the Ernest Mariot School of Pharmacy at Rutgers, open and non-pharmacy students as well. Again, a very, very high focus on multidisciplinary or interdisciplinary teams addressing social barriers, addressing health literacy or health illiteracy. We do, again, a lot in community outreach. There's a bullet point on here about billboards, diabetes awareness and education, created in collaboration with Rutgers and placed in 4 high traffic locations, including Route 18 and Route 527. So in summary, diabetes, an incredibly important issue for us to address. I wish there were less. We all do, but the facts are the facts are the facts, and better ways of using technology. Horizon working with our clinical partners like Dr. Knight, working with BD and other technology innovators is really how we are looking to advance, and certainly some of the earlier interventions that we have through our foundation addressing overweight in younger persons, and those kinds of efforts that can maybe reduce the prevalence of diabetes in our society. So I really appreciate your time, and I think we have a few questions in the chat.
Okay, well, thank you, Dr. Peskin, for your words on this most important topic. I'd like to launch our second poll for the day. The question is, do you feel like you have trouble communicating with your healthcare team about your diabetes? And we ask the audience, when the poll pops up, please answer the poll. We're going to leave it up there for several minutes to share and we'll share the results at the end. And while we're doing that, I'm just going to go through the questions. We have a couple questions that weren't answered yet. So let's see here. When you're talking about monitoring, what are your views on over-the-counter meters versus prescription meters? Are they both accurate? Anybody want to answer that?
I think I might take the first stab at it. All meters did pass a test, a standard to become available for you to use. Now, some meters are more accurate than others, and I think you have to take it upon yourself or work with your healthcare provider to see which one is most accurate. Now, maybe that most accurate meter might not make a clinical difference where it's maybe one of the less accurate, but they are accurate enough to help you control your diabetes. So you want to work with your healthcare provider, but each one has different accuracy. But all of them did pass tests to become available for us to use. And so one might be more accurate than the other.
Thank you. I have another question here. Any thoughts on intermediate fasting?
I will answer that. Certainly a lot of our patients, more so patients with type 2 diabetes, are quite interested in intermediate fasting. And usually I work through with them exactly what it is that they want to do. For many people, it's probably, fasting overnight, maybe in excess of 10 to 12 hours. We certainly look at the medications. Um, any fasting program that includes a patient using medications like SGLT2 inhibitors, you can have increased production of ketones. And so those are some of the things that we need to monitor for and make sure that they can be safe during the process. But my patients who've tried it, they have lost weight, and we have seen improvement in glucose control.
I have some personal experience. I don't have diabetes, but over like many folks of my age, baby boomers gained about 35 pounds over a number of years. And I followed a fasting mimicking diet, or intermittent fasting. It's championed by a subject matter expert, a PhD at the University of Southern California, Dr. Walter Longo, and it worked for me. Again, I would defer to people like Dr. Knight and other clinicians, and when I'm in clinic with patients, think through some of the challenges that might be associated with intermittent fasting in persons with diabetes.
We're going to do one more question, and then the rest of the questions will be answered by email. So where does education fall into the lineup of priorities to care for diabetes?
I think that education is one of the most important things in diabetes management. It is that everything begins and ends with education. It should be done when you're first diagnosed. It should be done if you're changing the medication, if there's some change in your life or clinical situation. The problem we see is that too many of our patients are not getting the appropriate education, and that is a major problem. So we strongly recommend that anyone with diabetes should be enrolled in a structured diabetes education program, and they should go through the classes so that they can really learn about diabetes.
And if I want to add one thing to that, we just did a study, or there was just a study published that actually looked at patients, all the patients were on insulin, and those that got insulin instruction and they actually did it correctly versus the other patients who actually did not get that insulin instruction. The patients who got the insulin instruction actually had a decrease in A1C by 1% and didn't change their insulin dosing at all by just learning how to inject their insulin properly through education. Actually got a very good reduction of A1C without really doing anything more than they were just doing before. So again, I thoroughly agree with Dr. Knight. Education is really important in all facets of diabetes care.
I just want to also emphasize, many of the diabetes centers like ours, we now have what is called a hybrid program. So you can choose to come in person, or you can have education using telehealth. We also have video-based program for education as well. So that area of diabetes care has expanded significantly, and we can work with the patient to figure out what will work best for them. There's another question about medication. If you cannot afford your medication, please note that many of the drug companies do have programs for patients. It's some paperwork, but there are many physicians who are willing to work with you to fill those out. They're also federally funded practices where they may have a clinic that's affiliated with that practice, where you may be able to get medications free of cost or significantly reduced. So there are options. The Diabetes Foundation is one of them.
Well, thank you, everyone.
Dr. Knight's point, we're actually paying for telemedicine. We're paying at parity. We actually also have, for the time being, waived copays for telehealth, and totally agree with her. It's been a really important adjunct, whether it be a person with chronic heart failure or diabetes or other chronic conditions, as well as for acute care.
Well, thank you very much. Before we finish, I want to go back to the polls today. Ben, can you please post the poll results for the first poll of our audience? So the first question was, do you feel you have enough support to manage your diabetes well? And 65% of the people that answered this said yes, and 35% said no. So hopefully today you've got some ideas about how to get better support, whether it be education, whether it be starting a team, finding an endocrinologist, or whatever it is that you need to move on. Ben, can you please post the second results? Thank you. Do you feel you have all the tools necessary to manage your diabetes? And again, we had 60% said yes and 40% said no. So hopefully, again, we've given you some insight today to what you can do to help improve the ability to manage your disease. And again, most importantly, working with your healthcare providers. So thank you for joining today. I'm going to turn this back to Janine, and I hope that we'll see you again soon for some other Diabetes Foundation webinars. Janine?
Thank you so much, Michelle. And on behalf of the Diabetes Foundation, Dr. Knight, Dr. Flug, Dr. Peskin, thank you so much for being here. Michelle, thank you for being our host today. As I mentioned earlier, our Diabetes Care Month is a 4-part series, and today concludes the second session. We have 2 more left. On May 19th at 5 p.m., join us as we take on diabetes myths versus reality. Our team of community leaders will dispel common myths and talk about the reality of living with diabetes. And on May 26th, we'll discuss finding affordable diabetes care. The Diabetes Foundation and our partners will provide insights about free and affordable resources that might be right for you. You can visit our website at www.diabetesfoundationinc.org/care month to sign up for those. And I just wanted to mention, based upon the conversation earlier, that the Diabetes Foundation does have some of the programs that Dr. Knight and Dr. Flug and Dr. Peskin were speaking about for free. We offer a support program called From My Living Room to Yours, and one of our diabetes experts on staff, who is also living with type 1, works with and has a support group for adults with type 1 and type 2 diabetes. We also have a support group for young adults from 13 to 21. It's called Voices of Diabetes, and it is hosted by 3 individuals who are between the ages of 19 and 21, who also are living with type 1 diabetes. We also have a diabetes self-management education and support program that we offer for free virtually, and we are accredited by the Association of Diabetes Care and Education Specialists. And lastly, as Dr. Knight explained before, we do have a free insulin program, but we also provide free supplies, including pen needles, syringes. Please go to our website, Diabetes Foundation Inc. Check it out. We encourage you to get involved. We are here to help. Thank you so much, everyone, for joining us. We really appreciate you being here and hope we see you next week.
Have a good evening, everyone.
Thank you.